afternoon. The COVID-19 regular briefing will begin in 60 seconds. Thank you.
Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our twice a month update on the coronavirus pandemic. What a difference we are as we head into the 4th of July weekend, and Dr. Bogan will fill you in on the testing results and all the numbers that we typically do and that we've done since last March. But the good news is so many of us are getting vaccinated, and we still have some to go. But as of today, 799,438 people in Allegheny County have had at least one shot in arm. So today in actions, we'll cross the 800,000, which is 80% of our adult population, which is again something we should all be very, very proud of, and the work that's been done from all of our healthcare professionals, obviously the health department and Dr. Bogan's team, and now we want to get that last 20%, and many of them obviously are the younger population, and Dr. Bogan will go over that as we go. But again, I was thinking about last year where we were coming into the 4th of July, and when we had that surge last June and so many things had to be shut down, we now this year can have the ability to be with our families, picnics, parties, et cetera, celebrations of our nation's independence on the 4th of July is just a great place to be. So let me turn it over to Dr. Bogan, and she can give the report on where we are. Dr. Bogan?
Thank you, County Executive. Good afternoon. This past Sunday, I had really the lovely opportunity to go to a music concert. The Indigo Girls were performing at Heartwood Acres as part of the Allegheny County Summer Concert Series. The county executive was there, and after the opening act, he brought me up on stage and introduced me to the crowd. And let me tell you, what I saw from up there was really a beautiful scene. There were people, so many people congregating, talking to friends, children were playing, everyone was outdoor enjoying themselves and listening to the music. I hadn't seen gatherings like that for well over a year, and truly it brought tears to my eyes. The enormous difference we are seeing in our lives in such a short period of time is truly remarkable. With more and more people vaccinated, our sense of safety and security is returning. We're back to a time and place where we can celebrate, enjoy being with our friends and family, and move really with confidence through the world, knowing that we're protected. So we're in a really good place right now, and the numbers prove it. Over the past 2 weeks, our average daily cases have dropped to about 13 a day. And I'm confident that these numbers paint an accurate picture. We don't have artificially low rates as a result of fewer people getting tested. People are still getting tested. The difference is that our positivity rate has dropped to about 1%, and perhaps more importantly, hospitalizations are way down. With this virus, we know that there will always be a certain percentage of people who, when they get this virus, will wind up in the hospital. So if there were lots of unidentified cases out there, we would be seeing hospitalizations, which we are not. So again, I'm confident in saying that we don't have many cases hiding somewhere in the community. This situation has truly improved. And again, I'm going to tell you why, and I told you this the last time we met. It's really due to the vaccines. All this good news can be traced to vaccines. They work and they are safe, and they are orders of magnitude safer than getting COVID itself. As for vaccination rates, these also continue to improve slowly. More than half of teens 15 to 19 and 62% of those 20 to 34 in the county are at least partially vaccinated. For older residents, the numbers continue to get better too. The rates with rate of 71% for people 35 to 49, 79% for people 50 to 64, and as previously reported, close to 100% for people 65 and older. This is all wonderful news, but truly I won't be satisfied until I'm sure that everyone who wants a vaccine has one. So we have a lot more work to do. For starters, there's a matter of equity. We know that some Allegheny County communities have traditionally been underserved, and that when the pandemic hit, these same communities were more vulnerable than others. Unfortunately, we are still seeing this inequity play out with vaccines, but we're working along with community partners to take steps to address inequities. The health department is in the process of analyzing vaccination data to pinpoint who has been underserved and where creative outreach is most needed. We're working with the Pennsylvania Department of Health to create a comprehensive picture of exactly where and how we can do better. That process continues, so the picture is not yet totally clear, but early indications from the data show that traditionally underserved communities continue to be most vulnerable. People in the Mon Valley, people of color, especially Black and Asian residents, have lower vaccination rates than other communities in Allegheny County. Simply put, we must fix that. We've already reached out to some community partners and leaders to learn of outreach strategies that have proven successful, and we will explore and consider the most creative and innovative of messaging and outreach methods. The bottom line is there is no shortage of vaccine in Allegheny County or the U.S. We just have to get it to everyone. We continue to get a trickle of calls through 211 to arrange for home vaccination for people who can't leave their homes. We and many others continue to hold community events, even though we rarely get more than 10 people a day, but every dose counts, and so that will just continue. So if you know of an area or of a homebound individual who needs and wants to be vaccinated, please call us, call 211, and we'll do whatever we can. So with that, I'm happy to open it to questions. Thank you. Be safe and be kind.
We have a number of questions this week. The first question comes from a number of parents inquiring whether or not kids should still wear masks and what protocol should be for attending summer camps and daycare centers.
Yeah, that's a really important question. Thank you. So, with the wearing a face covering indoors and outdoors is no longer mandated by the state. That state mandate ended. However, the CDC still strongly recommends that masks continue to be worn indoors in settings like childcare programs where children are not vaccinated. And outdoors, masks should be considered if social distancing can't be maintained for unvaccinated individuals.
Second question comes from numerous outlets, including the Pittsburgh Post-Gazette, WESA, KDKA, Pittsburgh Business Times, WTAE, and Public Source. The question is regarding the Delta variant. Has the Delta variant been found in Allegheny County? What are your concerns with the Delta variant in terms of A, how it will affect kids who cannot be vaccinated, and B, whether a fifth surge is possible in the fall? And would you consider a mask mandate if Delta cases do surge?
Let's see if I can get all that. So yes, we're aware of 2 cases of the Delta variant in Allegheny County residents, 1 each in samples from back in April and May, which means that the variant's been circulating here in Allegheny County for a while. Unfortunately, with the variant testing, we don't have a denominator. We don't know how many samples were tested, so I can't tell you a proportion or a rate, just that there were 2 cases. But again, our cases are extremely low here, so those were seen in April and May, and our cases continue to go down. So I think that's good. The Delta variant, we know from other places and from other data that it is more contagious. So if you get exposed to it, you're more likely to get sick and to have symptoms. It spreads more easily, and that it can cause more severe disease. So yes, we're all concerned about the Delta variant across the United States. And we look, when we look at data, we don't just look at what happens here in Allegheny County, but we're looking at the world. This is a global pandemic. And so it's important that we're constantly looking to what people have learned in other places where the variant is much more common. I make no predictions for the fall. We have talked about this repeatedly here, that we use data to drive our decision making, and so we'll see what the fall brings in any decision making. But I'll also remind people that masks are effective, so if you're worried, it's perfectly fine to wear a mask, even though it's not mandated. And so as our numbers change and things come in, we'll give you more information, but no predictions. I think I got all parts of that question, did I? Okay.
The next question also comes from multiple media outlets, including Public Source, WTAE, and the Pittsburgh Business Times. Does Dr. Bogan agree with health recommendations of the WHO and Los Angeles County officials that vaccinated individuals should still mask up, or with the CDC that vaccinated individuals no longer need to wear masks in most cases?
So at this time in Allegheny County, our cases are very low, about 13 cases a day in a community where we have 1.2 million people. So our rates are very low, and therefore I think that masks aren't necessary right now, except for those who are at risk for severe infection, those who are not vaccinated, and in specific settings where they're still required, like healthcare settings and other communities, places. And again, each organization needs to do their own risk assessment, so nursing homes and places may have different requirements. Of course, my advice changes depending on our data, and so that's my advice today based on our data today, and that could change. We're also very fortunate that we have a relatively high rate of vaccination in Allegheny County compared to other parts of the country, which also allows us to say that masks aren't needed right now in most settings. So I think that's where I'll leave that one.
The next question comes from WTAE. Will the county work with the state to determine next steps?
Of course, we've walked hand in hand with the state from the very beginning of this pandemic, and we'll continue to do so.
The next question also comes from WTAE. Should colleges require vaccinations for returning students in the fall?
I'm going to let the county executive take that one.
Well, what we have seen is a number of colleges and universities in the Allegheny County region have already mandated that. Carnegie Mellon University, Duquesne University, Chatham, and I believe Point Park just announced as well. University of Pittsburgh has taken a little different take, but in some ways they're also very similar, because the unvaccinated students and staff are going to have so many restrictions on them that it almost puts them in the same category. So I certainly have no problem with the universities requiring that, because they're trying to keep their students safe, they're trying to keep their faculty and staff safe. And as Dr. Bogan has said, these numbers have come down really for one reason: vaccines. The vaccines work. They've proven, not just here in Allegheny County, but across the country and across the world, that where you have a high percentage of vaccinations, the hospitalizations, the death rate, the fatalities, continue to drop. And we've seen our case levels, as you said, 13 cases a day. I mean, my goodness, we were at, a couple months ago, over 1,000 cases a day prior to the vaccination. So it really is, we're getting safer, because as you get to 80%, and we get to 90%, it's going to be safer and safer still. The big challenge, though, is you looked at those numbers, is among those young people. It's the people under the age of 30, under the age of 20, that the percentages are, they're getting up there, 50%, 60%. But as we return to school this fall, not just for our colleges and universities, but even our high schools and middle schools, we want to get those kids protected. We want them to be protected from this virus. And let me just, one other thing. I know we focus on the fatalities and we focus on hospitalizations, because those are the statistics that the CDC and the state and our department put out. But there are a whole lot of people who've been infected by this virus who don't show up in those statistics. We call them long haulers, in which they've had severe health implications regarding things like brain fog, fatigue, and other things that also affect young people in a disproportionate way. So I think it's really important that we make sure we get as many people vaccinated, and I applaud our colleges and universities for taking the proactive step that they do.
The next question comes from WESA and is a question for you personally, Dr. Bogan. What are your personal masking habits now that the statewide mandate has lifted? Are you still wearing a mask while in certain indoor spaces?
So I'll remind you that I am fully vaccinated, so this is my approach. When I go indoor to places where I'm not sure who's going to be vaccinated and who's not, and I'm going to be there for a while, like a grocery store or a retail store, I do still continue to wear a mask. When people come to my home and I'm not sure if they're vaccinated or they're not vaccinated, I ask them to wear a mask and I wear a mask. And outside, I don't wear a mask at the concerts or in the parks.
The next question comes from WTAE, WESA, and the Reading Eagle. Are enough people getting their second doses in Allegheny County? If not, what can be done to convince people to come back and get second doses?
So based on the data that we have from the doses that the Allegheny County Health Department has given, most people are returning to get their second doses. And if there are a number of people who don't want to do the 2-dose, they get the Janssen one and done, as I call it. And so our experience, at least from the vaccines that we've given, is that most people are coming back for their second doses. We are getting questions about second doses because I think there are some data that are confusing in terms of the state and the data we get. So we have very good data on the vaccines that Allegheny County Health Department has given, and we rely on the state for the rest of the county data. And I think there was some questions about the early registration system that was used and matching people in that registration system. So for instance, if I registered in that system and I put, the first time I registered Deb Bogan and the second time I put Deborah L. Bogan, the question is, does the software recognize that I'm the same person and put me in the database and match me up? And I think there was some issues with that originally, and I know the state's been working on that to make sure that they are at the back end correcting that information.
The next and final question comes from Public Source. How is the health department engaging community organizations and nonprofits in Allegheny County to advance vaccine outreach and education efforts, especially in reaching the vaccine hesitant or residents with accessibility-related barriers to vaccination?
Yeah, again, we've talked about this multiple times here, but I'll just review some of the things that we've been doing. So first of all, 211, the United Way, has really been a great partner. We have people can call 211 to get transportation to vaccines, also to get listed on our homebound list. And both the Allegheny County Health Department as well as a number of community partners are going out and giving vaccines in people's homes when we get those calls. So we're doing that. Many vaccine events have been held across, especially in the summer events. You know, we at the health department have held events at the Pride event on the north side, at the zoo, at libraries, at tap rooms. Other organizations have been at ball games, at the Juneteenth events, and many others across the county. We're doing educational outreach. We are using our MEE is doing trainings on how to do outreach and reach communities. We post a lot on social media. We have been promoting our videos, co-victories that we did with a local organization. I know that Pitt has a speakers bureau, and people can request having a speaker who will come and talk about the vaccines and COVID education. There's really so many activities being done across so many organizations, our universities, our not-for-profit organizations. Everybody's doing outreach to those that they work with, and we're supporting people and offering support where we can. I'll just remind people, if you have wonderful ideas that you think we should be someplace, our county executive offered this the last time we met, and I'm offering again. If you have ideas, you have places where you think we should be, call 211 or send a suggestion to our online form at the Allegheny County Health Department, or call our direct phone number, which I'll provide to you, 412-687-2243. And again, if you know of homebound individuals where we need to be going out, please call 211 to get registered in our system so we can do the outreach, because we do want to reach everyone and anyone who wants a vaccine. Thank you.
That was the final question. Now for final remarks.
Well, thank you. And let me echo something Dr. Bogan said in her final remarks are the outreach that has happened with so many partners in this community has been overwhelming, and it's heartwarming to see. She mentioned, the nonprofits, the community groups, organizations like the Pittsburgh Pirates and the zoo and our libraries. Our libraries are offering, which, we know libraries are considered this wonderful educational place and a nice, safe, place where kids go with families. They're doing outreach. So, but again, what Dr. Bogan said is we're willing to listen to suggestions of where we need to go. And as we find out communities where the percentage is lower than other places, we're going to work with local leaders, whether those leaders are elected people like the mayors and council members of a community, or teachers, clergy, coaches, all kind of folks to help us get the word out and make people safe. We know the data and the experience is overwhelming as how safe people can be. And, Dr. Bogan mentioned the concert series that we have, and we've run them all since June, since early June. We've had 4 at each Heartwood Acres in South Park, and to look at people's faces as they feel safe and feel secure and are out again with others is just great to see. And that's what we all had this goal when this pandemic began back in March of last year. So whether it's at workplaces, whether it's being with your friends and your family, we just want to get everybody vaccinated that we can. We've already done almost 1.5 million vaccines have been shots in arms in people in Allegheny County. As I mentioned, we're going to cross 800,000 people that have had at least one shot in arms. So that's a significant and a tremendous accomplishment that we all can feel very, very proud of. But let's get that last 20% so that we can all feel safe, we can travel, we can go to work, we can be with family, we can do all the things that we want to be able to do. So we'll be with you again in a couple weeks. Have a nice, safe, happy 4th of July with families that you didn't get to do last 4th of July. And let's celebrate the community becoming safer and getting back to normal again. Thanks and good luck.
Our next scheduled briefing is Wednesday, July 14th at 4 p.m. Thank you for